All right, welcome, Shelby. How are you doing today?
I'm doing very good.
So where are you located and what do you do?
I'm a senior behavior analyst and I work out of Bryan, Texas, and I cover multiple areas, but I'm primarily based here in Bryan.
So you are somewhat of an expert in the area of mental health. What does that really mean?
Mental health it's a combination of emotional, psychological, and social well-being. It can be impacted by our work life or home life, and it's a basic component to our overall functioning that many people have a tendency to overlook. So it's something that I'm very excited to see that it has its own month.
Yeah. So why do you think people over tend to overlook the importance of mental health?
Usually it's actually done with really good intentions. People often overlook mental health with the intent of helping others, where they put others people's needs before their own, or they want to work extra hours and they want to put an extra effort to prove. And it's this idea that if I help everybody else around me, it's going to come back to me eventually. But if we overlook ourselves too much, it has the opposite effect.
I think I've seen that before for sure. So what do you do to help promote mental health?
Oh, I love speaking with groups, with clients, with families, and working to abolish a lot of the misconceptions about mental health. I think the older misconception has always been reaching out for help is a sign of weakness, or more commonly that if you ask for help, it means that something's wrong with you. And instead of it being just everybody suffering, so when we see the big media push towards mental health now with athletes, professionals, and even Olympians are now reaching out for mental health concerns, it's starting to lessen the stigma and help encourage people asking for help.
Would you say that the mental side of things could also affect the physical side of things?
Well, absolutely. There's a huge connection. There's a world of connections, actually. If you don't get enough sleep, don't eat right, don't exercise, don't get enough sunlight, don't interact physically with enough people, it'll have a huge dampening effect. If I sleep in my bed 18 hours a day, my energy levels drop, I feel worse. And the ironic thing is, I feel like less like doing something. So I'm stuck in my house even more, and it becomes this cycle. And
Yeah.
physical activity and mental health, they're closely connected.
Well, it sounds like you're really passionate about this subject, but what would you say is the most fulfilling part of your job?
Oh, seeing people develop the skills to help others and to continue, I want to help them have long-lasting skills to where the idea is that one day they won't need me, that one day they develop all the skills and the hobbies and the habits and the social support network to get them out of any mess. And one day they can always reach out, but one day they won't need me. And maybe they can help others do the same. I love seeing that aha moment where everything begins to click.
So what would you say to those who aren't sure that they might need help?
Uh, Initially, if you experience the heavier ones, the suicidal or homicidal thoughts, obviously go help immediately. But if you're not quite there, I would definitely begin with speaking to someone you can trust that's gonna push you in the right way, because not everybody you trust is gonna push you in the right direction. I would suggest getting outside, staying active. Staying active is important. Never falling into a lull of wanting to isolate myself to the point of just pushing everybody away. Eating healthy, and like I mentioned earlier, one of my most common threads is I'm so busy extending myself in every direction that I eventually forget my own mental health. And the analogy I often give clients is if you view your mental health as a boat, I can't help save others from drowning or sinking their ships if my ship has holes in it. So make sure I'm good first before I start trying to help others. And it's basically make a mental health a priority for yourself. So my advice for them to be just develop the habits, develop the routines, the precautionary measures, have the healthy support network around you. And if none of that is working, that's when you can always seek professional help, and they'll help you develop those other areas.
So what are some easy tips you could give people just to make sure that there's no holes in their boat?
To assess it, to assess your lifestyle, to assess your reactions. If you're more irritable than you are on a normal basis, there's probably a good sign something's either bothering or psychologically, or maybe something's physical. Maybe it's just something as simple as I'm not taking care of my sleep pattern the way I should, or I'm uh, shoot caffeine withdrawals, substance withdrawals, and things like that obviously impact emotional well-being as well. And man, there's so many different areas that can be impacted by it. Some of the simplest tools would be just assessing, watching yourself, and talking to people around you, because sometimes we're blind to our own mistakes. So my loved ones are able to call me out quickly, and I'm assuming it's going to be the same with others around. So having a good, healthy communication and people you trust is very important.
And so if someone were to need help, what should they do?
Oh man, the first thing I want to reiterate, because there's such a stigma behind it, is that counselors are held to a confidentiality clause. So if you do reach out, nobody's going to find out about it unless you share it yourself. And there's websites, there's work programs that offer so many number of free sessions. Your insurance most likely has a number of free sessions. If not, you can call the insurance you have and figure out which psychologist in your area, therapist in your area willing to talk. I mean, and if you're afraid of all that, there's always things like, church or support groups in the neighborhood and counties and communities. There's so many resources out there that people are just afraid to reach out and actually just ask for help because I don't want to appear weak. And if we just get past that stigma, everything else begins to kind of start to build.
Yeah, that's great advice and such timely words, especially during Mental Health Month. So, Shelby, I really appreciate you joining us, and let's continue to get the word out. And hope you have a great day.
And so you do the same.